Hello, I am Dr. Keith Burke. I'm a professor of behavioral sciences in the Alcohol and Other Drug Studies program at San Diego City College. The AODS program is a vocational job training program, state funded for students who are studying to be certified alcohol and drug counselors. In addition to covering all the coursework necessary to sit for the state of California exam, the AODS students also get college level credits for their coursework, and that college level credit can be applied to further educational goals such as associate's degrees, bachelor's degrees, preparatory schooling for advanced degrees, etc. So today I am going to talk about cognitive behavioral therapy. This is a basic introductory cognitive behavioral therapy techniques lecture. Cognitive behavioral therapy is probably as well known as any other kind of mental health or any behavioral health intervention, really, as anything out there in the world. In fact, many people associate doing any kind of mental health therapy with cognitive behavioral therapy because it rose to such prominence. Historically, psychoanalysis, the work that Freud and Jung and Adler and some of those people did, was the dominant mode of therapeutic intervention for a long time, and cognitive behavioral therapy was a response to that. Originally started to develop in the 1960s, and then in the 1980s, 1990s, really took off and became the predominant way of being with clients. Today I'm going to talk about some of the basic introductory techniques associated with cognitive behavioral therapy. There's a lot more to cognitive behavioral therapy than what we're going to cover today. But we are definitely going to cover all of the essential foundational aspects of what cognitive behavioral therapy, or CBT, is. All right. Cognitive behavioral therapy was primarily developed by Aaron Beck, who was a psychiatrist in the 1960s as a structured short-term psychotherapy for depression. Since then, CBT has been developed and applied to a variety of mental health conditions and substance use disorders, and it's among the most widely practiced of all the clinical interventions. CBT techniques are also among the most researched treatment interventions for both mental health and substance use treatment, with very strong empirical support for its effectiveness, meaning that CBT works. It definitely has been shown to reduce symptoms in a wide variety of types of clients, in a wide variety of settings, being treated for a wide variety of concerns. And at this point, it is widely acknowledged by the largest research and treatment agencies as an established evidence-based approach to substance use and mental health treatment, meaning that SAMHSA, the U.S. Department of Health and Human Services, ASAM, the VA, all of them recommend the use of CBT as a primary intervention when treating substance use and co-occurring disorders. So let's talk about what cognitive behavioral therapy is. So cognitive behavioral therapy places thoughts first. So the thinking process is the primary place where cognitive behavioral therapy starts. Now, what that means is CBT focuses on how the client is thinking about any given situation, and then the impact of that type of thinking. The essential premise is that thoughts will then subsequently impact feelings and behaviors. Now, here's an example. If I see a dog, I'm out and I'm walking and I see a dog heading towards me, and my immediate thought is, oh my God, I think that dog is going to bite me. Well, that thought will then make me feel afraid, and my action probably would be to run away. Now, if I'm walking down the street and I see that same dog and I think to myself, oh, I think that dog is going to lick me, well, then I probably feel happy and I move forward in order to pet the dog. So note that the situation is exactly the same. The dog is coming towards me. It's the thoughts that dictate what happens next, what I feel and how I behave. So this is the premise of CBT as a whole. How we interpret or perceive situations, in other words, how we think about situations, is going to strongly influence what comes next. And our thoughts will influence our feelings, and our thoughts and feelings influence our behaviors. And then it continues on. Our behaviors influence how we think about something, which impacts our feelings, which impacts our behaviors, which impacts our thoughts, back and forth and back and forth. On the right side of this screen, this was Beck's cognitive tree, where he essentially said that negative views about yourself tend to lead to negative views about the world, which tends to lead to negative views about the future, which tends to lead to negative views about yourself. And if you're having all these negative views and negative thoughts, then your feelings are probably pretty poor and your behaviors are potentially going to be symptomatic and maladaptive. So let's talk a little more about thoughts, feelings, and behaviors. So one of the key questions is, what is most under our control? The way that we think about things, the way that we feel about things, or the way that we behave or act? So let's do a little exercise with this. All right, so the first question is, can you control your thoughts? So I'd like all of you, if you're not really paying attention to this lecture and you're just kind of letting it run in the background, to stop for a second and really pay attention. So I'm going to ask you to do some things here to see if you can control your thoughts. Okay, are you ready? Take a deep breath. All right. First thing I want you to do is to close your eyes and picture an elephant. See an image of an elephant in your mind. Now, I want you to think this thought. I'm going to fail the final exam. Just think that thought. Okay, now think, I'm going to pass the final exam. Just think that thought. Now I want you to think about a time or an event in your life that was upsetting to you in some way. Now I want you to think about a time or an event in your life that was fun and exciting. All right. So as you can see, to a large degree, we have control over what we think about, and we can potentially change those thoughts. So most of you probably saw an elephant when I asked you to picture an elephant in your mind. Most of you, when I told you to think the words, I'm going to fail the final exam, you were able to think, I'm going to fail the final exam. And then when I asked you to think, I'm going to pass the final exam, you were able to think those words as an alternate. Most of you also would have been able to think about a time or an event in your life that was upsetting, and then think of a time that was fun and exciting. So again, to a large degree, we have control over what we think about. And when asked, we can then change those thoughts or replace them. All right. So let's now move over here to feelings. Okay, I want everybody to get prepared. Okay. The question is, can you control your feelings? So I want you right now to close your eyes and try to feel angry. Without thinking of anything else, just try to feel angry. Okay, feel angry. Are you feeling angry yet? Now I want you to close your eyes and picture someone who made you angry in the past. Like, get an image in your head of someone who made you angry in the past. And now I want you to try to feel angry while picturing that person. Okay, now I want you to think of a place where you felt happy or relaxed. And then I want you to try and feel happy and relaxed as you think of that place. All right, so most of the times, feelings or emotions are accompanied by a thought or an image, which is needed to control the feeling. Meaning that for most of you, when I asked you to close your eyes and try to feel angry without thinking of anything else, it probably was very challenging for you to do that. Most of the time, we can't spontaneously generate emotions unless we've got a thought or an image that we associate with that. Now, when I asked you to picture someone who made you angry and to really focus in on that and try to feel angry, most of you probably found it much easier to feel angry when you were thinking about someone who angers you. And similarly, when I asked you to change that, then I asked you to think about a place or an event where you felt happy or relaxed, and then try to feel happy or relaxed in that moment. Most of you were likely able to do that. So it was hard to feel an emotion without having a thought or an image. But once you had that thought or image, you could feel the emotion. And then when I asked you to think about something else, you were able to change your emotion. Typically, it is much easier to control our thoughts than it is to control our feelings. Feelings can be controlled to some degree, but the path to controlling feelings often starts with controlling the thoughts or the images that lead to those feelings. Again, when I asked you to think about somebody that made you angry in the past, you may have been able to suddenly generate feelings of anger. And then when I asked you to feel something different and you used a thought of a place or event that was happy or relaxed, you were able to change that too. But it is virtually impossible for people to feel an emotion on cue without an accompanying thought. Even actors use imagery and thoughts to create emotion. So when an actor is in a play or they're in a movie and they're asked to generate an emotion, most reports are that the actors will generate some thought or image in their mind, and they use that to generate or amplify the emotion. This is important. Let's talk about behaviors. So by and large, behaviors are primarily driven by choice, meaning we can decide what to do or not to do at any given point. Now, choice can be conscious or it can be semi-conscious. There are some important behaviors that happen outside of awareness, but this is relatively rare. Like when we wake up, I mean, that could be defined as a behavior. And for the most part, that's happening outside of awareness. We just wake up, or we might become aware of an alarm clock, and then we wake up. Or sometimes we're semi-conscious about something. We're not really thinking about what we're doing, kind of like driving a car. For most of us, once you've driven a car for many years, you're not really thinking about what you're doing in the act of driving. So again, there are some behaviors that happen outside of awareness, but for the most part, important behaviors, things that we act upon in our life, we're choosing to do that. And typically what we choose to do in any given situation is driven by motivation, which is a desire or a reason to do something, which is strongly influenced by what we think or feel about a situation. So choosing to do homework, for example, for those students out there who may be listening to this lecture, that is a choice that is strongly driven by motivation. If you think to yourself, I don't need to start the homework now, I've got days before that's due, well, that will tend to decrease your motivation to complete the homework. Whereas if you think, oh my God, this is due in 6 hours, and you suddenly start to feel anxious, well, that is going to impact your motivation, and you're likely going to choose to behave differently. Now, behaviors are sometimes thoughtless and not controllable. Again, for example, we have to sleep at some point. But if you look closely, most of the time, there are thoughts and feelings that are influencing much of what we do or how we act. And while many behaviors can be automatic, many become more controllable by becoming aware of the thoughts and the feelings that are behind the behavior and choosing to think differently. Let me repeat that again. So a behavior could be automatic in the sense that we're just doing it without much thought. But behaviors tend to become more controllable when we become aware of the thoughts or the feelings that are behind the behavior and choose to think differently. So let me give you an example. So we have to eat. As humans, that is a necessary function. But some of when we eat and how we eat is controllable. So I'll give you 2 examples. So the first one, I'm sitting around watching TV and I see an image of pizza on the TV. And suddenly, because I see an image of pizza on the TV, I start thinking of food and I feel hungry. Now, semi-consciously, meaning I'm probably not putting a lot of thought into it, I may then go to the kitchen and I open up the refrigerator to find food to eat. So what's happening there is that the behavior, the action of me going to the kitchen to open the refrigerator to find food to eat is being driven by the fact that I was prompted by the TV to think of food, and thinking of the food made me feel hungry. So now I'm acting. But take that same exact scenario, and this time I'm sitting on the couch and I see an image of pizza on the TV. But now I think about my new fitness plan. Maybe I've joined a gym, and me and my trainer have sat down and we've talked about my fitness plan and we've come up with a schedule. Now, having seen the pizza on the TV, I'm still thinking of food and I'm feeling hungry, but I'm also feeling motivated to stick to the eating schedule that I've developed. And so now I choose not to go to the kitchen because I know if I do it, it'll be harder to resist looking for food. So again, the same scenario, but in the first one, I'm not really paying attention to what I think and what I feel, and I'm just tending to act based upon those thoughts and feelings. In the second one, I'm becoming more aware of what I'm thinking and what I'm feeling. And even though there may be an impulse to act in some way, I choose to act differently. So for the most part, the aspect of the cognitive triangle, the thoughts, feelings, behaviors, and how they're related to each other, the aspect that's most under control is our thinking process. Behavior is also under our control, but it's strongly influenced by how we think and feel about something at any given time. And many times changing the thinking process takes less effort than changing the behavior. So thinking about going to the gym is less of an effort than actually going to the gym. But thinking about going to the gym may then influence further thoughts and feelings about whether I want to do that or not, which is going to influence whether I get up off the couch and actually go. Now, emotions are the hardest thing to control without addressing the thoughts and images behind it. But again, in the same way that we did this exercise, when we think about certain images or certain things or certain people, and we allow ourselves to feel feelings associated with that, then we can start to control our emotions to some degree. At its most basic level, cognitive behavioral therapy works like this. First, you identify the stressor, which is typically an emotion, I feel stressed, or the behavior that's causing problems or concerns. So examples could be symptoms of anxiety as an emotion, continued substance use as a behavior. And then what you're going to do is try to identify the thought or thoughts, the beliefs or the images. For example, picturing a traumatic experience might be an image that's associated with the stressor or the behavior. So using that image there, picturing a traumatic experience may cause feelings of anxiety. And because I'm feeling feelings of anxiety, that leads me to use a substance. So we first identify the stressor or behavior, and then we try to identify the thought that's associated with that. And then we want to examine the thought. How is this thought affecting the situation? Is this thought accurate, or is it appropriate to the situation? And how will changing the thought change the situation? This slide right here is really the basic premise of cognitive behavioral therapy. And much of what CBT does comes from this basic premise. Now, another important aspect of CBT is the premise or belief that feelings, behaviors, and symptoms are made worse or maintained by biased thinking. So the tendency to think in a certain type of way about something. And the idea is that by modifying, reducing, or eliminating maladaptive thinking, typically through the use of evidence and logic, as we'll discuss a little later, then symptoms can be reduced and better actions can be taken. Now, this requires practice. Much of our thinking is automatic, but we can change what we're thinking of or what we focus on. So earlier I asked you to picture an elephant. Now I want you to picture a giraffe. And so again, we can change what our mind is holding on to in any given moment. So the general principles of CBT as a whole. Cognitive behavioral therapy is present focused, meaning that it addresses what's happening right now related to current symptoms through a systematic analysis of thoughts, feelings, and behaviors and what's within the client's power to change, versus exploring the past or searching for reasons that explain the symptoms. Now, CBT has sorry about that. CBT has some similarity to solution-focused counseling, which also focuses on the present rather than what's happening in the past. In both CBT and solution-focused counseling, we're in some ways a response to psychoanalysis. Each of them developed at a time that psychoanalysis was dominant, and people were spending a lot of time on their therapist couches talking about the past and exploring all the reasons, why they thought and felt this way based upon things in the past. So CBT is less concerned about the past. What it's mostly concerned about is right now. What are you feeling right now, and what thoughts and feelings are associated with that? So obviously, CBT is thought-focused. As we've already emphasized, the goal is to help the client recognize and understand how their thoughts might be contributing to irrational fears and worries, faulty plans, and unrealistic expectations. Now, this includes mental health symptoms, and it includes cravings, thoughts, plans about using. CBT is very applicable to treating co-occurring and substance use disorders because of this. CBT is symptom focused. So the goal is positive results through symptom reduction. So if you're feeling anxious, you feel less anxiety. If you're using substances in spite of it causing negative consequences, you're now not using substances in a way that it's causing negative consequences. So the goal is to reduce the symptoms in a short period of time, primarily by changing the way that we think about things. Now, there's a strong emphasis on psychoeducation and relapse prevention of the symptoms. The psychoeducation part is that the client being taught CBT learns about the relationship between thoughts and emotions and behavior. And then once they understand how thoughts affect feelings and behavior, now the goal is to develop a plan to implement alternative or different ways of thinking and acting to impact feelings and improve the situation. Practicing and completing homework. Cognitive behavioral strategies for new and alternative ways of thinking is a skill development, and it must be practiced between sessions and then reported back and discussed with the counselor. Now, homework is important so that clients can apply these skills that they're learned during the sessions to multiple situations in everyday life. So coming to a counseling session and talking with the counselor about your thoughts and how that impacts your feelings and your behaviors is good. And talking about how to change the way that you think and perceive situations to try and feel and act in different ways is also good. But the bottom line is that is happening inside the counseling setting. And so a huge part of CBT homework is to encourage the client to practice what they're learning in session outside of the situation in everyday life. The idea is that this will help the person develop independent use of cognitive behavioral therapy skills without the counselor present. And there's lots of research that indicates that clients who complete homework have much better treatment outcomes. And homework can be lots of things. Again, in this basic cognitive behavioral therapy introduction, I'm not going to talk a lot about thought records and some of the other typical assignments and exercises that are done as part of cognitive behavioral therapy, but there are a zillion workbooks out there on various cognitive behavioral therapy skills and homework that's been applied to all kinds of settings. There are substance use treatment workbooks that uses CBT homework related to treating substance use disorders. There's mental health workbooks using CBT to treat mental health. There's very specific mental health workbooks, CBT for anxiety disorders, CBT for depressive disorders. There's lots and lots and lots of homework out there that is essentially continuing to evaluate how thinking is affecting feelings, is affecting behaviors. There's also homework related to evidence gathering and hypothesis testing, which I am going to talk a bit more about in this presentation. More to come with that. Uh-oh, What's happening? Why is my PowerPoint not moving? There we go. Okay, and then the final principle is to prioritize the main or the primary thought stressors. So although all thoughts can affect emotions and behaviors, the primary focus in CBT are the main types of thinking that are causing chronic, long-lasting stress and problems. And most of the time, those types of thoughts are related to automatic thinking and cognitive distortions, which we'll talk about both. All right, so let's discuss automatic thinking. So most thoughts happen without clear origin or conscious intention, meaning that our mind is just roaming around thinking all kinds of random thoughts, and we don't necessarily always know where those thoughts are coming from, nor are we deciding to think that way. Our mind is just thinking on its own. So in other words, it's thinking automatically. Now, many automatic thoughts are not stressors. They're simply random thoughts that are running through our minds, and we're not so concerned with those. Now, sometimes automatic thoughts may simply be associations, like you smell a particular perfume and that causes you to automatically think about a specific person. Now, those automatic thoughts are important. So this particular example, maybe not so much. Smelling a perfume and thinking about a specific person, as long as thinking about that person is not creating stress and causing us to behave in inappropriate ways, then we're probably not going to focus so much on that in cognitive behavioral therapy. But sometimes associations will do that. We smell a particular smell, which causes us to think about a particular person. So if the smell of marijuana smoke automatically makes us think about our dealer who used to sell us marijuana, and that leads us to feeling cravings to use marijuana, which leads us to calling the dealer and going to get our marijuana, well, then in that case, the association, if we've got a problem with marijuana, is something that we may focus on in CBT. But you get the idea. So some automatic thoughts are just random rolling around our head. Sometimes automatic thoughts create associations. Now, many times negative automatic thoughts can be and are self-corrected in the moment. So even automatic thoughts that cause negative feelings or behaviors can be self-corrected. So an example of this is sitting down to take an exam and feeling anxiety. So that is a common experience for many students. You have studied and you go to sit down and they're about to hand out the exam, and all of a sudden you start to feel anxiety. And then an automatic thought pops into your head, like unwanted. Suddenly you think, oh my God, I'm going to fail this test. So the self-correction in the moment may be then realizing that you're feeling anxiety and you just had that thought. Your more conscious mind jumps in and says, okay, just breathe, take a deep breath. And maybe you take a deep breath and now you think to yourself, I studied and I'm ready for this. I'm good, just relax. So another one very similar to what I was just talking about, in relation to feeling triggered for substance use. For students in the alcohol and other drug studies program, you may be having a lesson or listening to a lecture where there's an image of an IV drug user that pops up. Somebody's got that as a picture in their PowerPoint and suddenly feel craving. Maybe you were formerly an IV drug user and now your heroin use disorder is in remission and you're working a program of recovery, but this image, this thought causes a feeling of craving, and the automatic thought is it'll be different this time. And so in this case, the self-correction, the more conscious part of your mind may jump in and say, no, it won't. I'm not going to think about this right now. Just listen to the lecture. So the idea here is that negative automatic thoughts really happen to everybody at some point in their life, but most of the time people can self-correct. They recognize that they thought this, and then they think something different in order to impact how they're feeling or how they're acting. Now, some automatic thoughts may be negative, but they're accurate to the situation, and they lead to understandable feelings and appropriate behavior. So like, for example, if I lie to my best friend about being unavailable to attend her sister's wedding, and then she sees a social media post of me having fun at the beach and calls me upset, my automatic thought might be that I'm a bad friend and I might feel guilty. And so because I think I'm a bad friend and I feel guilty, I apologize to my friend and I ask for forgiveness. So in this case, all of this is appropriate and accurate. So I had an automatic thought and I had a feeling that was appropriate to the situation, and it then led to an action that is also appropriate to the situation, apologizing and asking for forgiveness. Now, this typically isn't a situation that's going to require extensive work with cognitive behavioral therapy because it's appropriate and the person in this example is doing something that is correct for the instance and not causing undue stress. However, when a particular way of thinking leads to negative or undesirable feelings or behaviors, the first attempt might be to simply try to change the thinking process. And sometimes that's easy to do. And when things are easily changed, then it's often not a primary focus in cognitive behavioral therapy. But sometimes automatic thoughts are harder to change because they become habituated, meaning that they're repeated without conscious intention. However, evidence does show that even habituated automatic thoughts can be changed, but it typically takes a bit more effort. Now, by changing the thought, then the feelings and the behaviors often will also change with little additional effort. So to say that again, some automatic thoughts can be changed easily and quickly. We think something and then our brain jumps in and it just says, don't think that way, and we think differently. Those we're probably not so concerned about. But sometimes automatic thoughts are harder to change because they become habituated. They've been repeated again and again and again inside our mind. Now, for people who suffer from substance use disorders and mental health disorders, many times these negative, habituated, automatic thoughts are really problematic. For somebody who has an anxiety disorder, constantly thinking, oh my God, it's not going to work, I'm going to fail. Oh my God, it's not going to work, I'm going to fail. Oh my God, it's not going to work, I'm going to fail. And they've said this to themselves so many times that now it's become habituated, and that leads then to additional feelings of panic, not wanting to try, avoiding putting oneself out there. Those are much harder to change than more simple automatic thoughts. But even when something's habituated, typically all it requires is some awareness that it's become habituated, and then with some effort, we can probably change that. So let's try this here. I want you all to look at the picture that's on your screen. So on the picture, you see a red rose. And what we're going to do here is we're going to test automatic thoughts. Roses are red. And many of you thought violets are blue. And you did that without conscious intention. Because of the association, we saw an image of a rose, and then the prompt, roses are red, violets are blue. That's an automatic thought that's become habituated. I didn't tell you that you were going to think that. I didn't even tell you to prepare for that. I just said that we're going to explore automatic thoughts, and then I gave you a cue of a red rose. Now, that's happening without conscious intention. It's a habituated way of thinking, but we can change that with a little bit of effort. So what we're going to do now is we're going to change that automatic thought. So this time when I say roses are red, what you're going to do is say grass is green. Okay, you ready? So you're going to put those two together. When I say roses are red, you think grass is green. Roses are red. And I imagine almost everybody who's watching this, if you put just a little bit of effort, it wasn't that hard to then say to yourself, grass is green. Now, roses are red, grass is green is not a habituated automatic way of thinking. So far as I know, that phrase doesn't exist out there. Nonetheless, when not being conscious, you automatically fell into violets or blue. But when you were conscious and you put some effort into it, you could change the thought process from the prompt. So that's really the goal of what we're doing in here, is to become aware of what we're thinking and how we're thinking, and then to change that thinking process. Okay, For those of you that are watching this video as part of a course at San Diego City College that you're receiving credit for, this is the key phrase non sequitur. You're going to be tested upon the conclusion of this video lecture, and one of the questions is going to ask about a keyword or a key phrase. This key phrase is not going to be on the PowerPoint slides, and you're only going to know this if you watch the video. So the key phrase for this video is stop thinking and end your problems. Again, stop thinking and end your problems. All right, that's a famous saying by Lao Tzu. We're going to move on back into lecture. All right, so CBT recognizes that automatic thinking is often not evaluated. In other words, the person simply thinks this way without considering alternatives. So roses are red, violets are blue. You're not evaluating how you're thinking, you're simply doing it without considering that you could think something different. So if I told you, you don't have to think roses are red, violets are blue, you could think something different like roses are red, grass is green. Most people probably haven't put very much thought into that. So the first part of any CBT process typically starts with an in-depth exploration through the use of questions, objective questions, about the key automatic thought that seems to be influencing or affecting the emotion or the behavior. So what we're going to do when we're talking with a client who is stressed or behaving in inappropriate ways, we're going to try and figure out what is the thoughts behind this that are influencing the behaviors. So I'll keep using anxiety and substance use. So if we are treating a person with a co-occurring disorder because they have anxiety and they have problematic use of marijuana, they're smoking pot a lot, what we will do typically is try to explore the thoughts behind that. So from that then, Judith Beck, who's the daughter of Aaron Beck, who was the founder of CBT, and Judith Beck was an accomplished CBT therapist herself, she created a series of questions that a counselor can use to explore automatic thoughts. So my thought is when I feel anxious, I have to get high. That's the only thing that works for my anxiety. So then if Judith Beck was working with me, she may say, okay, how much do you believe this thought, that marijuana is the only thing that will help you with anxiety? So when you think this, marijuana is the only thing that's going to help me with my anxiety, how does that make you feel? And what do you tend to do after you've had this thought? How do you act or behave once you've had this thought? And how satisfied are you with this outcome? And so what we're doing here is we're just exploring the thought. How much do you believe it? How does it make you feel? What do you tend to do after you have this thought? And how satisfied are you? Continuing, exploring the situation that we associate with the automatic thought. Okay, so what happened right before you had that thought? So in other words, if I'm thinking, oh my God, pot's the only thing that'll help me with my anxiety. Okay, well, what happened right before you had that thought? I was thinking about the fact that I haven't completed my homework that's due in 6 hours. Okay. So there's another factor or event that's happening at the same time as that thought. Are there other things that often happen at the same time as having that thought? When did this thought first emerge? Do you notice any specific triggers that might have caused the thought to arise? And so what we're trying to do here is see if we can explore the origin of the problematic thought. Then we want to explore how typical this automatic thought is. How often do you have this kind of thought? An automatic thought that causes negative consequences or negative emotions, but it hardly ever happens, won't typically be a focus of CBT. But if it is something that happens a lot, we want to know that. So how often does this happen? What types of situations tend to trigger this kind of thought? How much does this kind of thought bother you? How important would it be for you to change this type of thinking? Other questions are related to identifying co-occurring thoughts or images coupled with that automatic thought. So did anything else go through your mind when you had this thought? Did you see any images or pictures in your mind when you had this thought? Did this thought lead you to another thought? How often does it happen that you have these thoughts, images at the same time? So what we're really doing here is simply exploring the thought and the thinking process. And we're trying to get a really good, detailed picture of what the thinking process is. Now, many times thoughts have beliefs that are associated with them. So we want to explore the belief that might be underlying this thought. So I'm going to fail the exam might be the thought. And so what's the belief underneath that thought? So if you were going to fail the exam, what would that mean? Well, if I fail the exam, then I would fail the class. And what would that mean? Well, it would mean I'm just stupid. I'm not able to do this. And so here, the thought I'm going to fail the exam has a belief underneath it, which is that I'm stupid. So we would want to expose any underlying beliefs. Now, we also want to find out, is there problem solving that's already associated with this thought? So how do you typically handle situations like this? When I can, I just step away and I go watch television for a period of time. Okay. And so what about this situation? Well, I couldn't do that because it was a final exam and I was in the classroom, so I freaked out. So in this case, at least we would have some evidence that the person does have an ability to problem solve when they have these thoughts, but maybe they don't have an extensive range of coping skills. And so we just explore, how do you typically do this? What are some things you could do about this next time it happens? What do you wish you could do in situations like this? There might be an underlying skill that hasn't been developed yet. And so again, these questions are all just designed to explore. Now, the counselor doesn't have to ask each and every one of these questions. These are just example questions when you're trying to really flesh out what is this thinking process and what's it associated with? What is it coupled with? Now, the idea in these types of questions is to develop primary awareness about the automatic thoughts and then the feelings that they generate. So it essentially boils down to, when you think this way, how does that make you feel? And when you feel this way, how do you tend to act? And if you're able to think about this situation differently, how might that make you feel or act? All those questions are essentially circling around this same basic idea. Okay, so now let's talk about cognitive distortions. So although CBT focuses on all the types of thinking patterns that cause the client distress or are contributing to problematic emotions or behaviors, oftentimes the thinking that's causing chronic, long-lasting problems is a distortion, meaning it's an exaggerated misinterpretation of the situation. And sometimes that kind of distorted thinking can become an automatic thought, which is really problematic because now, without prompting, the thought is just popping into the person's mind and it's not actually a realistic thought. It's an exaggerated misinterpretation. So the most challenging negative thoughts are those that are not only habituated, but don't accurately reflect reality. And these are typically the primary focus in cognitive behavioral therapy and often take the most work in order to fix. So examples of cognitive distortions, they're totally talking about me. I'm never going to get this situation right. This, if as a cognitive distortion, might not actually reflect the reality of the situation. People might not be talking about that person. And anytime I'm never going to accomplish something is said, that's usually not true. In certain situations, this may be difficult, but it doesn't mean that it couldn't be accomplished in a different situation. Now, cognitive distortions are problematic in two ways. The first and obvious one is that they're causing stressful or problematic feelings and behaviors. But the second one is their lack of accuracy. So the failure to reflect actual reality is irrational. In other words, since cognitive distortions are irrational, they don't actually represent the truth. They represent a mind or a way of thinking that's distorting the truth, which means that the mind is creating or it's amplifying the problem. So having a normal, understandable reaction, I lied to my friend about not being able to go to her sister's wedding so I could go to the beach instead. And then I have the feeling I'm not a very good friend and I feel guilty. That's rational. That makes sense. That's accurate to that situation. But if I have an irrational thought about something, everybody's talking about me, they all think I'm stupid. The problem there is that I'm generating the stress and anxiety and the subsequent behaviors. In other words, I'm kind of my own worst enemy. And so that's where the examination has to start. We need to do all those exploratory questions to figure out, where did this thought come from? What's it related to, et cetera. So cognitive distortions, just briefly, the history of that. Aaron Beck, who kind of created cognitive behavioral therapy, first developed this idea in the 1970s. There were two textbooks that he wrote: Depression, Causes and Treatment, and Cognitive Therapy and the Emotional Disorders, where he first started talking about cognitive distortions and why they might develop. And then Beck's student, David Burns, who was also a psychiatrist, popularized this concept of cognitive distortions with common names and examples in his textbook, Feeling Good, the New Mood Therapy. So although many since Beck and Burns have revised and modified and renamed cognitive distortions, the major classification categories for the types of cognitive distortions remain pretty much as first proposed by Beck and Burns. And this is helpful for clinicians to recognize when a type of automatic thinking appears to be falling into a cognitive distortion category. So let's review some of the major cognitive distortions. So the first one is mind reading. So mind reading is assuming that you know what other people are thinking without having sufficient evidence of their thoughts. So an example, everyone thinks that I'm a loser. So I'm assuming that I know that everybody is looking at me and they're thinking that I'm a loser, even though I don't have evidence that's actually what they're thinking. Fortune telling is believing that you know the course of outcomes based on your impression of the situation. So I just know that he's going to dump me is a type of fortune telling. That may or may not be based in reality. There may or may not be evidence, but basically I've decided this is what's going to happen because this is what I'm thinking about the situation and my impression. Catastrophizing is believing that what just happened or what you think is about to happen is a disaster. In other words, it's something far worse than it actually is. So you find a lump on your cat's leg, and then you immediately assume that your cat has cancer and she's soon going to die. This would be a catastrophe, a catastrophe. Just having a little bit of fun here, PowerPoint on CBT. So the idea here is that you make an immediate leap that based on the way I'm thinking about something, it's far worse than it actually is. Emotional reasoning is believing that what I feel must be true, must be automatically true. I feel this way, therefore it must be true. So an example of this is, I feel jealous, so my wife must be cheating on me. So I'm using my emotions to come to a conclusion, which is then causing me to feel and act in certain ways. So in other words, I might be acting like a jerk and attacking my wife, and yelling at her, I know you're cheating on me, and asking her a million questions, about what she was doing after work. And all of this is happening because it's a cognitive distortion. It's actually my own anxieties, right? I'm feeling anxious about my wife, maybe cheating on me because I believe that I'm not good enough for her. But what I'm doing is I'm using that to then act in a way based on my feelings, assuming that it must be true. Unfair comparisons is interpreting events in terms of standards that are unrealistic for you. You look really good in that outfit. Well, I'm no whoever, right? So I don't know who the latest beautiful celebrity is, but you can come up with a fill in the blank beautiful celebrity. Labeling is assigning global, meaning it applies to everyone, traits to yourself and others. All men are cheaters. So using this distortion of labeling. So I think that all men are cheaters. Thus, I feel anxious and mistrust around all men, which impacts then how I act. The tiniest little thing they do, I assume that they're cheating on me. Discounting the positives is claiming that the positives that you or others attain are trivial. So you did really well on that test. It was too easy. I'm sure everybody else got an A too. Negative filter is focusing almost exclusively on the negatives and ignoring the positives. So a student has consistently received A's in the course, but gets a C on one quiz and focuses on how poorly she's doing in that course. So again, to remember, these cognitive distortions, once they become automatic ways of thinking, create stress. They create emotional stress, feelings of stress, and then they create behaviors related to that. So maybe here the students consistently received A's, but she gets one quiz, and now she can't stop thinking about how terrible I'm doing in that course, and related to that, I'm going to fail on the course. And suddenly she drops the course in the middle of the semester in spite of the fact that she has A's because she got a C on one quiz, which then makes her feel worse about herself. She's never going to be able to accomplish this program, right? And then she fully drops out of school, and it just compounds. So the idea here is to look closely at the distorted thought that's setting this whole thing off. Overgeneralizing, perceiving a global pattern of negatives on the basis of a single incident. I'd never get a cat. Don't you know that cats pee on everything and ruin your carpets? My friend had a cat who once peed on her shoes. So here, on the basis of one single incident, the person is overgeneralizing. Dichotomous thinking is viewing people, events, and things in all or nothing or black and white terms. You get a job and you tell everyone it's a perfect job and your boss is the best ever. And then after your 90-day evaluation, your boss gives you some constructive feedback on the job evaluation. Maybe she tells you that you can improve your group notes and write them a little better. And suddenly she's horrible and she obviously hates me and this company's bound to go bankrupt. Personalizing is believing that everything others do or say is some kind of direct personal reaction to you. So you bring a box of homemade cookies to work and somebody says, no, thank you, when you offer it to them, and you immediately assume that person doesn't like you, they think their cookies are better than yours, or they must still be angry about that comment you made 3 months ago about their tie being too wide. The shoulds is interpreting things in terms of how things should be instead of simply focusing on what is or making rules about how to act. So the new car looks great. I should have gotten the black one. The white one was stupid. It's going to show all the dirt. I should always be available to my kids and wife. So, should types of thinkings create lots of stress. And again, it's not focusing on what is, it's focusing on something that we ultimately have little control over. Blaming is focusing on other people as the source of your negative feelings and experiences and refusing to take responsibility for changing yourself. So my mother is the reason why I never have successful relationships. She was abusive and screws me up. Thus, because I think this way, then I feel anxiety about starting relationships, and thus I don't get into relationships, which causes me additional stress. Regret orientation is focusing on the idea that you could have done better in the past, which you have no control over, rather than what you can do to impact your situation now. Maria was my soulmate. If I hadn't been such a jerk, then we would have gotten married and then things would be perfect. I'll never find someone as good as Maria. I'm doomed to be alone. What ifs is responding to any situation with a series of what if questions and failing to be satisfied with the answers. Let's go to New York for vacation this Thanksgiving. Well, what if it's too cold? Well, what if there's another terrorist attack? Well, what if it's too expensive? Well, what if there's no affordable hotel rooms? Which now makes me feel depressed and I don't want to go on vacation any longer. Failure to disconfirm is rejecting any evidence or arguments that might contradict your view. So the response to that, well, actually the weather historically is pretty mild in New York around Thanksgiving. Well, that's just ridiculous. If it's north of San Diego, then it means it's going to be cold. Well, I found some inexpensive hotel rooms on the internet. Well, I'm sure that they're trashy and dirty, which is probably why they're so cheap. Judgment focus is viewing yourself and others according to some arbitrary, random, or personal view that doesn't have a reason for it. So according to some arbitrary standard and constantly finding you and others falling short. So, well, gosh, everybody should own a home by the time they're 30 years old. And I don't own a home, so that proves that I'm a failure. So here, the arbitrary standard, everybody should own a home by the time they're 30, is causing, feelings of depression, feelings of anxiety, and beliefs that I'm a failure. All right, there's more than just that. There's lots and lots of worksheets that are out there, but those are kind of the basic categories of cognitive distortions. And so the idea here is that when somebody has cognitive distortions, over time, repeatedly thinking in this way, repeatedly thinking in the what if way, or repeatedly disconfirming the positives, tends to then become automatic, like other habitual behaviors. You're not thinking about it anymore, you're just doing it. So the way you're driving your car, the way you're folding your clothes, the way you personalize everything becomes an automatic way of thinking. So when cognitive distortions are automatic thoughts, They can have really powerful effects on feelings and behaviors, but like any thoughts or behaviors, they can be changed. So cognitive distortions are also excellent candidates for closer examination of the evidence and an exploration of the alternative hypothesis. So exploring the alternative hypothesis is another one of the foundations of cognitive behavioral therapy. So exploring the alternative hypothesis is examining a cognitive distortion closely to see if it has a basis in fact. And also, we're going to examine it to see if that might be because there's alternatives that would lead to that. Now, when doing an examination like this, the counselor is often challenging whether or not this belief might be true or possibly false, and whether there might be alternative explanations, which are going to be used to try different ways of thinking about the situation. So the important thing here is that all the good clinical skills that counselors have been taught, certainly students in the AODS program have been taught, need to come into play. So if you're challenging somebody's belief system or cognitive distortion, you're probably going to meet some defensiveness. And so using good skills like reflective listening and summarizing and forming good therapeutic rapport are really important. In addition, using motivational interviewing to try and get around defensives. But the idea here is that CBT's exploration of the alternative hypothesis is an important first step to see if we can think about the situation differently, which will then impact feelings and behaviors. So exploring the alternative hypothesis uses a scientific approach. In other words, well, let's hypothesize that that happened because of a different reason. Let's see if we have any evidence for that. And so in CBT, this is often referred to as collaborative empiricism. Those of you who are students in the AODS program, you might see that phrase at some point, somewhere before the end of the semester. So collaborative empiricism means that the counselor and the client are working together in order to gather evidence and test hypotheses. So this evidence is used to test the client's beliefs and assumptions, and it's being considered for alternative explanations. So in other words, if a client's belief, like it's all my fault, is shown to be potentially an inaccurate way of thinking about the situation, well, then there's going to be a more likelihood that the client's going to be open and willing to try a different way of thinking. Whereas if we have a cognitive distortion that's become an automatic way of thinking and it's really entrenched, then the person is less apt to consider an alternative way of thinking. So what we're doing here in getting the alternative hypothesis, the precursor to thinking about it in a different way. Now, exploring the alternative hypothesis, the counselor primarily uses questions that are designed to encourage the client to become aware of the cognitive distortion and explore alternatives. This is very important. So telling the client the alternative possibilities, oh, I'm sure it wasn't totally your fault. I'm sure somebody else had something to do with that. That's just going to run right up against defensiveness and justification. So kind of similar to motivational interviewing in some ways, exploring the alternative hypothesis uses questions. These questions are designed to get the client to think their way around the corner on this and consider the fact that there might be another possibility. Now, Judith Beck, who I mentioned earlier, who had created questions for exploring automatic thoughts, also created a series of questions to evaluate the accuracy of cognitive distortions. And so the first section here, is there any evidence for this automatic thought? It's really just a simple series of questions around, well, do you have any evidence that it's all your fault? Is there any evidence that it could be somebody else's fault? And what we do is just start the exploration. Well, how do you know that? How do you know that's true? Is there some other reason it might have happened that way? Do we have any evidence that that's true? And if you assume this automatic thought is true, how does that make you feel or act? So if you assume that everything's your fault and you're the whole reason why, I don't know, the substance use treatment agency where you work and you were the counselor, they're closing and you somehow believe, oh, it's all my fault because, I somehow didn't do a good job of trying to keep people from leaving treatment. And it's kind of ridiculous. example, right? But go with that. Like, okay, so when you believe that the agency is closing because it's your fault, well, how does that make you feel or act? Okay, so we have some evidence that it's probably more than just you failing to stop people from leaving treatment. There's the fact that the agency's been underfunded. There haven't been enough people. The agency is in a very rural area of San Diego County, and there's not a lot of clients. So there's lots of other reasons why the agency might have failed. So if you assume that's true, that the agency failed for a number of reasons, well, then how does that make you feel or act? And so what we're doing here, exploring the evidence, how it affects feelings and behaviors. We need to often consider the alternative hypothesis. So what we're going to do is ask, is there a possible alternative explanation for this situation? Is there any evidence for that alternative hypothesis? Could there be evidence that supports the alternative hypothesis if explored? So like, in other words, if somebody's like, well, I don't know if there's another reason why that's happening. Okay, well, if we explored that, right, if we asked other people, if we went and checked this out, is it possible we might find evidence that suggests an alternative hypothesis? And then if the alternative explanation turned out to be true, well, how would this affect your thinking and feeling about the situation? Now, many times exploring alternative hypotheses and testing these alternatives is a thought exercise, meaning that the client and counselor are doing this in conversation in an office or a clinical setting, and there may be limited opportunity in the moment to gather evidence needed to test the alternatives and compare the results. But sometimes testing alternatives may simply be an extension of logic or rational thought. So even though it's a thought exercise that I'm doing with my client, I might just simply ask some questions to determine that there must be an alternative. So I'm going to fail. Okay. So what's your actual grade right now? It's a B. Okay. So you think you're going to fail, but your actual grade is a B. So is it possible that you're not going to fail this course? And so what we're doing is using logic and rational thought. As another example, everyone hates me. Really? Your mother hates you? I thought you had a good relationship. Well, no, not her. She doesn't hate me. And your best friend? Well, no, not her either, right? So here what we're doing in using logic and rational thought is we're taking, this generalized labeling and we're testing to see whether or not that's actually true. Weed is the only thing that helps my anxiety. So what else have you tried? Well, nothing really. Okay. So it sounds like you think that weed's the only thing that can help your anxiety, but is it possible there's other things out there that help anxiety? Well, I mean, probably, right? So what we're doing here is we're testing the alternatives, again, just by using questions to challenge the thinking process using logic and rational thought. But sometimes testing alternatives may mean actually doing field research to see if evidence can be found to support the alternative hypothesis. So if the client insists that his boss hates him, well, then we may do homework. So the homework might be to ask his coworkers if the boss treats them in the same way, or have his coworkers heard anything in particular that confirms that the boss does hate him particularly. Or a client could be encouraged to go talk to her psychiatrist about alternatives to medications. I'll never find a medication that works for my PTSD. Okay, so have you talked with your psychiatrist about alternative medications? Well, no, but I've tried different medications over the years. Okay, so it sounds like you've tried some medications, those haven't worked. Have you tried all the medications that could possibly be prescribed for PTSD? Well, no, probably not. Okay. So I'm wondering if it might be possible that there is a medication out there that could help for your PTSD. And I'm wondering if maybe we could test this, by finding out, by talking to an expert, who prescribes medications. Now, sometimes it may not be possible to find evidence either for or against the alternative hypothesis. So if somebody says, my father always thought I was weak, and that makes them feel depressed, and they don't want to try. So did he ever say that to you? Well, no, but I could tell. Okay. Could you talk with him about that right now? No, he's dead. Right. So in this case, it's going to be very challenging to get evidence either way if dad actually thought that. And so then the counselor will attempt to reframe this if evidence can't be established. All right. So is it possible that he just didn't understand your decision. And so what we're going to do is explore possibilities as the alternative hypothesis. Now, when evidence can't be definitively established, the effect of thinking one way or another can still be explored. So sometimes the counselor may suggest, all right, well, let's act as if the alternative hypothesis is true, and then explore with the client how acting as if the alternate hypothesis was true, how would that affect your thoughts, your feelings, and behaviors? So again, related to some of the questions Judith Beck had developed for this, if you can't determine for sure which way of thinking is most accurate, well, what's the effect of believing the initial way of thinking? Well, what would be the effect of believing the alternative hypothesis? Well, what could be the effect of changing your thinking or choosing to believe the alternative? And so again, we're just exploring, if one makes me feel better and one makes me feel worse, then the goal may be, can we practice then changing our thinking? And then continue to evaluate the impact of the automatic thought applied to the situation. So if the initial automatic thought was true, if what you believe really was true, well, what's the worst that could happen? Could you tolerate this or could you correct this? Well, if the alternative hypothesis were true, then what's the worst that could happen there? Could you tolerate or correct this? Well, what's the most realistic outcome? And if an effort was made to act this as if the alternative was true? And so again, note that the counselor is not telling the client, the counselor is using all kinds of questions to see if the client can develop their own thoughts and ideas and awareness about how the thoughts are affecting the feelings and the behaviors. Okay, so the overall goals of CBT, the exploration and examination that's at the heart of CBT is designed to increase awareness, encourage developing different ways of thinking for more positive feelings and behaviors, and to empower client control. So by examining perspectives and thinking patterns and choosing to think differently, somebody can take more control over their feelings and behaviors. And in the case of cognitive distortions, it can sometimes separate the actions of others from their own interpretations of the world. So in other words, believing, that my dad thinks that I'm weak, but through exploration, I realize there's lots of evidence that I'm not actually weak. Well, what I'm doing is separating my dad and his comments and his actions from how I see myself, which gives me a sense of greater control. CBT encourages healthier thinking patterns by first becoming aware of the negative and often unrealistic thoughts that impact feelings and behaviors, and then making effort to change how you think about those things. And then CBT develops tools to problem solve the things that make people feel upset or worried by examining or changing the thoughts and behaviors that are influencing those feelings. All right. So we're not going to do this here because this is a recorded lecture, but when I do this lecture live with students, we will often explore a case study. And it's worth going through this exercise here just to see. So if Maria is a student at San Diego City College, here's the situation. This morning, she's on her way to class, and she saw one of her professors in a crowded elevator, and she said, "Good morning," but neither her professor or anybody else in the elevator replied. And so Maria immediately begins thinking thoughts like, my professor doesn't like me, no one likes me, I sounded stupid, I'm going to fail this class because the professor's against me, I'm never going to be able to get through school, I'm never going to be able to get a job that pays me enough to make it, right? The thoughts cascade in her mind. And Maria's automatic thoughts block her from considering that her professor may not have heard her, or that her professor might have been preoccupied with her own thoughts. And so these cognitive distortions make Maria feel depressed. And now she can't focus in class and she's thinking about withdrawing from the course. So Maria is a perfect client for using the CBT skill of exploring the alternative hypothesis. So if we were in class, what we would do then is start to generate a discussion about what kinds of questions could we ask Maria first to explore her thinking and how those thoughts are affecting how she feels and behaves, and then asking questions to see if we can examine and explore the alternative hypothesis, which we won't do here because it's a recording, but I would encourage you to stop and think about this. If Maria were your client, what types of questions might you ask her? All right, so as we come to an end here, just an important point of clarification. This is an introductory presentation of basic cognitive behavioral therapy skills, and it does not intend to encompass the entirety of CBT. There are many textbooks out there about cognitive behavioral therapy. There are certainly more advanced applications of CBT that are not covered in this presentation. And students who are interested are encouraged to continue their study of CBT. But the basic ideas that we talked about today, exploring and understanding how thoughts affect feelings and behaviors, and about how changing the way that we think about something could potentially impact feelings and behaviors, is really the foundation and the core of CBT. All right, and so then we'll just end with a cartoon. So your problems are caused by all or nothing thinking. It's either that or you don't have any problems. So, all right, that takes us to the end of the CBT lecture. As always, if you are watching this lecture on YouTube and you have questions or comments, please feel free and encouraged to use the comment box, and I'm happy to respond. And those of you who are watching this because you're a student at San Diego City College in the AODS program, presumably you have access to my email or me in the classroom. So if you've got further questions, please ask, and I will be happy to talk more about this. All right, thanks again for watching.